Welcome, Dr. Meg Rosenblatt, the Chair of the Department of Anesthesia at Mount Sinai, Morningside, and West Hospitals.
Thank you.
Thank you for being here today. I appreciate your time. She is recognized as the first person to administer 20% intralipid therapy to treat local anesthetic systemic toxicity in a patient. For those of us who may not know you very well, can you please give us a brief summary about yourself?
Well, I'm currently a professor of anesthesiology and orthopedics at the Icahn School of Medicine at Mount Sinai. I was the chair of the 2020 annual meeting of the American Society of Anesthesiologists, and I'm the current chair of the general chair of the 2021 New York State Society meeting, which is known as the PGA. I am what's called a full examiner for the applied exam for the ABA, and I just finished my third term as a senior editor of the basic exam. Right now, I'm spending a lot of my energies as a member of the board of directors for ASRA and on my own healthcare systems appointment, promotion, and tenure committee. I have also been married to my husband, David Stein, for more than 34 years, and I'm the mom of two amazing adult children.
Well, welcome, and thank you for joining me today. You're very accomplished, and I look forward to this wonderful conversation. I wanted to actually ask you a little bit about your experience as the first person to administer intralipid for local anesthetic toxicity. How did doing that change the trajectory of your career?
My goodness, I was giving a lunch break when somebody walked back in the room and said to me, "You should see what's going on in the holding area." And I raced out there, and there were the smartest people in my department, doing CPR, and I literally had a light bulb moment. I wish I could tell you that there was lipid in the operating room. I remembered reading something. I said, "Do you guys mind if I try?" And literally, the holes in the cheese lined up for me. And again, I didn't wake up and say, "Today something is going to happen that's
right,
going to change the trajectory of my life." It was just right place, right time, and reading. Please remind all of your listeners that there are journals for reasons, and you don't have to read them cover to cover, but whatever pertains to you needs to just be put in here to be pulled out if it's ever needed. And the rest is history. I got to meet Guy Weinberg, who did all of the basic science that brought us here. I got to meet tons of people who used it for other lipophilic agents and were able to really help and affect patient care. And it just set me on a path of just understanding how really wonderful the community of basic scientists and clinical researchers, specifically in the regional anesthesia realm, were. And they were the ones that I started talking to and telling them what I was doing with an ultrasound back then. And then I moved into being able to teach workshops and teach basically how to do regional anesthesia with an ultrasound at its very beginning. I'm not going to claim that I'm from Toronto or Nysora or any of but at the very beginning, we were a small group of people trying to figure out where we were going to take this machine, and the lipid was my entree to meeting these other people. So it really set me on a fantastic course. Again, lucky and appreciative.
That's great. It's fascinating that, an article that you came across and it just stuck in your mind, and then the case presented and you were able to act, and it helped you in many, many ways, I'm sure.
Very lucky.
Changing course a little bit on the topics here. Which leadership roles early on in your career were most influential in you attaining your current position?
Oh, well, first of all, I think that running the board or being a clinical coordinator in a large university hospital center that does transplants, I mean, when you walk in the morning and there are 2 kidneys and a liver sitting on a desk, and you know there are at least 3 rooms of surgeons that you're going to displace, and you need to do it with a smile on your face, really does teach you some valuable people skills. Let's face it, anesthesia is the easy part of the job.
Mm-hmm.
It's learning the HR, which has really been the challenge. So being that coordinator certainly helped. Being on a lot of committees and learning how to work with people were important. And also being on my own departmental appointments and promotions committee and helping to shape the way we present our members to the healthcare system appointment and promotion committee was also very valuable.
Tell me a little bit more on how you developed your leadership skills outside of like work experience.
Absolutely. I did it through a lot of failures. I really failed. Talking to people with hard talk is a learned skill. And I was with somebody who would always say, you're a great person. This is the problem, but you're a valuable person and we respect you. And people take the last thing that you say to them. And that last, because you feel you have to leave them with kind words, really dilutes the message that you need to give. So I actually had a lot of help through the Harvard course for clinical leaders. Mm-hmm. I also had a professional coach, which was a hard thing to find someone who suited my style, but it was a lot of role play. I would say, this is the situation. And he would say to me, well, this is what needs to be said. And I would say, that's not going to come out of my mouth. And then we did role play till I could get the words out in a way that was natural to me, but still conveyed the message. So these kind of leadership skills were certainly not taught to me. They were sought and they were learned with a lot of reflection, hard work, and a couple of failures until I sort of got pretty good at it. Mm-hmm, mm-hmm,
mm-hmm. Thanks for mentioning that about having a coach to like teach you these communication skills. I personally find that very challenging as well. Even communicating basic stuff can be somehow misconstrued and challenging in itself. So,
you know what? When I have to talk the hard talk, I still write a list for myself. Mm-hmm. That for the high points, and I check them off as I go through them. And when I'm done, I stop the conversation. Mm-hmm. I found that if I let somebody, give me their excuses based on their own inability to see what they're not or are doing, it just really, it dilutes the message and it just doesn't work for me. Maybe it works for other people, but you have to find out what does work for you. Mm-hmm. Mm-hmm.
Do you have any regrets in the choices that you made or the opportunities you passed up?
Yeah. Mm-hmm. My regret is that I didn't try to do this earlier in my career. There are things that derail you, geographic limitations, family obligations, and you get into a groove of something and you think it's fine. I didn't realize there was something that was different, more challenging, and that I could really do it. It took somebody, one of my trainees said to me many years ago, they said, you should really try to be a chair. And it was, again, another light bulb moment. Me, like it wasn't in my game plan. Nobody tells us what our options are as academic anesthesiologists. And somewhere during this talk, you're going to talk to me about mentorship. And I'm going to tell you that in the early 1990s, there was no mentorship. Mm-hmm. I was very lucky. I've stolen this from my then chair. who would call me in every year and say, where do you want to be in a year and how can I help you get there? And I use that technique all the time, but then it just stopped. There was no, what you would be good at, or what you should think about doing, or what I need you to do. And that's where I've picked up on that and moved along as someone who is a mentor to not only all of my residents, but all of my attendings. You should think about this. Or, how do you want to get there? And I don't remember why I started down that road about regrets or about choices, but I did not know that chair was ever in my wheelhouse, in my options for all the life activities that were going on around me.
I think that's still common today. A lot of people just say ask their colleagues, what do you want to do? But no one ever says, you should consider thinking about doing X, Y, or Z. I feel like that's still something that's maybe not, maybe it sounds paternalistic a little bit, and that's why people shy away from that. But I think you're right. People don't know what's available. I mean, I don't know what's available of everything either.
If paternalistic is bad, my education and my leadership style is maternalistic. But I talk to people about developing their story. At the beginning, when you are that Jack Russell Terrier, you can do a little bit of everything. But then there comes the time where you have to pick a direction. And I will say to somebody, that's an interesting study, but why are you all the way to the left when we're going to the right? What? And the other thing about a story is many years ago, somebody reminded me that you can't get ahead doing what somebody else has done. You really need to create your own story. And I will sit with somebody and say, these are the components and this is the timeline. And then again, annually, we do that phrase. Where do you want to be? Are you anywhere closer? Are you not there because of something you have done or haven't done? Or have I not given you the resources to get there? And then we reassess the timeline and try to fill in the gaps. I'm going to brag. I had somebody promoted yesterday. It was the long game. It took 5 years, but we followed the path, and it was another win for my team.
Well, congratulations. That's
wonderful. Thank you. It's like I said, every time somebody succeeds, it's all of our wins, and it just feels good. But it was, this way is never going to get you promoted. You really should go this way. And while you're going this way, check your CV every 3 months, add to it, add extra. We can always take it off. I don't want to forget any decision you made or any clinical thing that you've done. Just do it. And these are my tricks to getting people ahead. A lot of looking at your CVs.
Yeah, that's nice. That's nice that you do that. You're right. You need to look at your CV and kind of know where you're going and how
There's nothing worse than starting from scratch for 10 years ago. It doesn't work.
Thank you. Thank you so much for your time. I appreciate all this wonderful conversation. You're very fascinating and you gave so much great advice. Thank you.
Well, I thank you very much for listening to me. And, whoever's out there listening, please don't hesitate to reach out. If you've got specific questions or anything I can help you with, because like I said, that's what I do.